So we will have our next speaker, and this is Mrs. Lucy Thomas, and her presentation is Gift from One Sister to Another, How APS Changed Our Lives.
Thanks very much. Hi, I'm Lucy, and I'm here to talk to you about my story and my experience with APS. So I'll just go through the obstetric side of it, and then my clotting history, and then how I was diagnosed and where I am today. So actually a lady mentioned earlier that she had a history of polycystic ovary syndrome, and it may just be a coincidence, but I was diagnosed with PCOS when I was 17. And I was told that I would never have kids, so it was never on my radar. And then when I was 29, I just became pregnant. So this is great news, really excited, completely out of the blue, and our lives were about to change forever. Everything was going fine, and then I had a significant bleed at 11 weeks. I can hear myself, so I'm going to step back a bit. And I was told, you know, you probably lost your baby. We'll give you a scan in a week. I thought, I can't wait a week. I need to get a scan tomorrow to see if my baby's alive. So I went and got a private scan. And they said, no, everything's fine. You're okay. Relax. It's going to be okay. So I did. And then at 29 weeks, suddenly things went a little bit wrong. I had a routine fundal height measurement with my midwife. And she said, actually, your baby's looking pretty big. I think you need to go and get a scan done. So off I went to hospital and got a scan. And the lady said, actually, no, your baby's tiny. And the oxygen saturation is not good at all. You need to go and get yourself to your proper hospital. So off I drove to the next hospital. And they admitted me away and said, look, this is quite serious. You're going to have to deliver your baby in the next couple of weeks. But we want to keep you in here and monitor her and see how it's going and deliver her as late as we can. So I was under the impression that everything's fine still, you know, it's my first pregnancy. And then a couple of days later, my sister was by my bed. We were just having a little picnic. And again, suddenly, you know, just out of nowhere, massive pain, started bleeding, and, you know, my placenta had abrupted. So I was in agony. I should just remember, you know, the stress and the trauma of it, and just not having a clue what was going on. And so they whisked me down to the theatre and said, we're going to have to deliver. And then it was a few hours before they were able to do that. Unfortunately, it was a busy day, and they put me under general anaesthetic and woke up and, you know, where is she? And unfortunately, she was stillborn at 30 weeks. So if I just talk then about where we went from here. My dad had a DVT a number of years ago, and my grandmother on my mother's side also had thrombosis when she was pregnant with my mum. So after Isabel was stillborn, I was in hospital for 5 days, and they looked after me tremendously. It was, you know, been better given the circumstances. But I developed significant chest pain. I couldn't stand up, I couldn't really move, and the chest pain was, you know, sort of in the front and the back, and just everywhere. And I had a number of consultants and doctors coming to speak to me, and couldn't quite figure out what was going on. And I think I had a number of blood tests and things at the time, although I don't really remember, to be honest. And I think they just put it down to, as a result of the C-section, sort of trapped air in there was causing me some discomfort. So after 5 days, I was discharged anyway. And then I had, you know, the routine midwives coming, community midwives coming to the house to check up on me. And I, you know, sort of crouched over and still can't quite stand up properly. And they're like, oh, you look uncomfortable. I'm like, yeah, I'm not feeling great. And again, you know, they just thought, we think it's probably just a bit of air in there. So, you know, just keep walking, keep moving around, and it'll get better. And then it was actually Isabel's funeral that my mother-in-law said, Lucy, you don't look right. You can't stand straight. I think there's something going on. So she said, you need to get yourself back to hospital. But I didn't want to do that. I'd spent enough time in there, I thought. And then the next morning, I woke up with a very funny sensation at the back of my leg, at the back of my knee. And there was no redness, there was no pain, there was no swelling. It just felt like there was something there. And I couldn't explain it, because that wasn't, a DVT as far as I knew it. There was no signs of a DVT other than a funny feeling. But I did go to my doctor, and he said, there are no clinical signs of a DVT there, but given your surgery, you're probably a little bit, you're not feeling your best sort of mentally, which I wasn't. Go to the hospital and see what they say. So they admitted me to hospital, and then a couple of days later I was still there. They'd done a D-dimer test, the bloods came back normal, and they said, look, you look all right, there's nothing really wrong with your knee. And I was saying, yeah, but I'm still in pain in my chest, can you do something? I'm getting worried and really anxious. So I was there for another couple of days, and then on day 5 they gave me a CT scan, and that revealed that I'd had multiple pulmonary embolism. So straight away they said, we want warfarin, and you're going to need to be on this for 6 months. So I know that a lot of you have had a lot worse than that, but for me at that time in my life, that was really big news that I wasn't prepared to deal with. I mean, I didn't even know what warfarin was, let alone anything else. So off I went home, and I started warfarin, and I got better. I could start moving, and I could stand up straight, and I felt better on that. And then I saw a consultant, so the question of antiphospholipid syndrome, again, never heard of this before, came up, and they said, your lupus antibodies, anticoagulant antibodies are slightly raised. So we're going to need you to come off warfarin. And then in 12 weeks, we do the second test just to see if, you are at risk of clotting it again or not. And suddenly I just thought, wait a minute, no, I'm not coming off this if there's a chance that I could clot again. So my mental health really spiraled out of control, actually, at this stage. I just wasn't really sure what to do. So I went online, and I joined a community online, and I'm sure some of you are on here on Health Online. There's some women and men on that community, and it was really through them that I realised what I needed to do. So I got myself down to the London Lupus Clinic, and I met Professor Knashta. And he said, you don't need to come off warfarin. There is something we can do. It's not perfect, nothing is, but if you want to try it, we can give you a dilute Russell Viper venom time test, I think. And so I said, yep, let's do that. And it came back, and it said, yes, your anticoagulant antibodies are still raised, a few months on. So he said, my diagnosis is that you have antiphospholipid syndrome. But at this stage, my INR levels were all over the place, so I was having to go to hospital 2 or 3 times a week, and it was, down at 0 point nothing, and up at 6, in a matter of, I think someone said earlier, in a matter of 24 hours, and I couldn't really understand why that was. I was keeping a food diary, a drink diary, I was being super healthy and conscious of what I was putting into my body at that stage. So he said, I'd recommend you go on rivaroxaban if you're happy with that. So that's what I did. I also met a fantastic lady at University Hospitals Coventry in Warwickshire that you may know as well, Professor Siobhan Quemby. And she said if you do want to try for a baby again in future, then what we'd recommend is going on metformin. It's a diabetes drug, and that's because of my polycystic ovary syndrome, to help me ovulate, as well as you'd need to go on aspirin daily and twice daily heparin. So she sent me off with these drugs in the eventuality that maybe one day I'm pregnant again. And I moved to France, and I got myself really healthy and had a year out of just eating well, drinking a bit, and exercising. And through her plan and her treatment, I did get pregnant again. And this is Camille, who's now 19 months old, and she was born very healthily, no complications whatsoever. Yes, so it's a happy ending. And then my question, I guess, to the medical people is, what are the clinical differences between obstetric APS and thrombotic APS? From a selfish point of view, I guess that's because I've had both. So I had the clots, but I also had the late pregnancy loss. And I don't know if it can be answered, but if I need to be really on lifelong anticoagulation, or am I just obstetric, or am I really at risk and I need to stay on it?
That's why she said that.
So just to explain, we'd asked all the speakers of their presentation to raise one question they'd like to be dealt with in the panel discussion, and that's why Lucy has kindly done that. So we'll be dealing with all those questions in the panel discussion.